Hello, I'm Dr. Dayle Borchardt from Forest Grove Veterinary Clinic. And today I'd like to help you better understand vaccinations in your dog.
Dr. Dayle, what vaccinations does my dog need and why are they important?
The vaccinations that are most important in our part of the world are rabies, parvo, distemper, hepatitis, also known as adenovirus, and parainfluenza. Some dogs, if they go visit other dogs a lot or go to public places, are also recommended to get kennel cough or bordetella vaccine.
Are vaccines for dogs really safe?
Yes, vaccines for dogs are very safe. Some dogs can feel a little bit under the weather for a day or two after vaccinations, but the consequences of not being vaccinated can be really serious. So, vaccines are always safer than having the disease we're vaccinating against.
Are there any risks or side effects associated with dog vaccinations?
Any vaccination that we get or our pets get can cause us to feel a little bit under the weather, maybe not as energetic, maybe not as much of an appetite for a day or two while our immune system does the job that it's supposed to. In rare cases, anaphylaxis or serious allergic reactions can happen, but those happen very quickly within the first 15 minutes. And often we are able to address those immediately while pets are still in the clinic.
At what age should my puppy receive its first vaccinations?
Most puppies come home around 8 weeks of age, and we should see them at that point for vaccinations. Sometimes puppies receive vaccines before that age, and we should still do a checkup, but they might get vaccines on a slightly different time frame than some other puppies.
How often will my dog need booster shots?
For puppies, booster shots are given every 3 to 4 weeks until they're finished their puppy series. After that, they'll come back for a 1 year booster, and depending on when they come in, we can also put them on a 3 year vaccination protocol.
What is the difference between core and non core vaccines?
Core vaccines are the vaccines that are recommended for every puppy or dog in almost all areas of North America. And the reason for that is that it covers diseases that are very serious and lethal in many cases. So if every dog is protected, then no dogs are going to be infected. Non-core vaccines are vaccines that we give based on your pet's lifestyle. So some dogs are at higher risk of something like kennel cough because they go to kennels, dog parks, groomers, places where there are other dogs that they don't know. Some dogs go traveling and they go in wilderness areas, and so they are more at risk of something like leptospirosis. In Saskatchewan, we don't have some of the diseases that exist in warmer climates. So we tailor your dog's vaccine protocol to match his lifestyle.
Why is the rabies vaccine important for my dog?
Rabies vaccine is very important. One, because the vaccine is really easy to give to dogs. For those of you who have never been vaccinated against rabies, like we have in the clinic, it's quite an ordeal for humans to get vaccinated and protected. Number two, rabies is 100% lethal. And so if your dog is exposed to rabies, then there is really no chance. And we want to prevent that as much as we possibly can.
What is the distemper and parvo vaccine and what does it protect against?
The distemper and parvo vaccine protects against those two diseases, and they are, again, really tough to prevent puppies, especially from getting because they exist in the environment. They're always going to cause disease, and sometimes that disease is serious enough to be life threatening. The vaccine works really, really well, though. And so, even if they haven't had all of their puppy vaccines, they're still at less risk if they've had some.
What are the symptoms of an adverse reaction to a vaccine?
I'm glad you asked this question. So adverse reactions are different from side effects. Side effects are things that we expect to happen after vaccines. And so we expect dogs to feel a little bit tired and under the weather. Adverse reactions are things that happen that we aren't expecting. In the case of dogs, they can have anaphylactic reactions. They're very rare, but they are really serious and do need to be treated immediately. They can also have vaccine site adverse reactions. So, where the place that we gave the vaccine can get swollen, it can get red, there can be discharge, and sometimes the hair can fall out. All of these are things that should be reported to your veterinarian.
What would be the symptoms of my dog having an anaphylactic reaction?
Anaphylaxis in dogs looks like either intense, immediate vomiting and diarrhea after a vaccination, or it can look like fainting.
Will my dog be sick after their vaccination?
Generally, no. Most dogs do just fine after their vaccines. In rare cases, they can feel a little bit under the weather and a little bit tired, maybe not as much of an appetite for a day or two. Um, in very rare cases, they can have an anaphylactic reaction that needs immediate treatment. But those reactions happen within 15 minutes of a vaccination, and usually your pet's still at the clinic and we can deal with that right away.
Can my dog be vaccinated if they are sick or on medication?
So, when we vaccinate, what we're asking the body to do is mount a good immune response to the antigens or the types of diseases that are in the vaccine. If your dog's immune system is already working on something else because they're sick, then we don't expect them to have a good immune reaction to the vaccine and it may not work as well. If your dog is on long-term medications but isn't actively sick, then yes, they can have their vaccines. Dogs that have chronic diseases are actually at higher risk because sometimes their immune system doesn't work as well. And we need to make sure that we remind it with a vaccine about the serious diseases we're preventing.
What is kennel cough and should my dog be vaccinated against it?
Kennel cough is the short term for canine infectious respiratory disease complex. And really, it's not specific to kennels. Dogs can get kennel cough signs, so a dry, hacking cough, from contact and sharing airspace with other dogs, whether that is in a groomer situation, at the dog park, or daycare. Lots of different places can put your dog at higher risk.
Can vaccinations be harmful if my dog is pregnant?
Many of the vaccines we use are called modified live viruses, and they can cause harm to puppies that aren't born yet. So, vaccinating pregnant dogs can be a risk.
Are there any dogs that shouldn't be vaccinated?
Dogs that have had an anaphylactic reaction in the past or have a severe adverse reaction to a vaccine may not be recommended to get that vaccine in the future.
How can I keep track of my dog's vaccination schedule?
It can be a real challenge to keep track, especially if your dog's on a 3-year return for many of the vaccines. The good news is we will have the records. So if you're ever unsure, you can always give us a call. If you want to keep track at home, there are vaccine booklets that you can fill out, and you can even bring them into the clinic and we'll help keep them up to date for you. You can also put reminders in your phone. But I definitely recommend checking on them with us because that's our job to do.
What should I do if I miss my dog's vaccination appointment?
Give us a call. Sometimes we have lots of leeway in when we can vaccinate, and sometimes we reevaluate based on changes in your dog's lifestyle anyway. So give us a call and we can definitely check whether or not we need to see them immediately or whether we can schedule that for in the future, the next visit they're in.
What should I do if I notice my dog's behavior change after a vaccination?
If you're noticing behavior changes after a vaccination, that's worth noting and certainly letting us know about. It's not common for dogs to have any kind of behavior change after vaccination, and so we would be worried about something else going on.